Hello everyone, myself Dr. Poonam Nanwani. Today we'll discuss breast pathology. Let's start with the normal breast. From the external surface, we start from the skin. First, there's a nipple areola. You can see here there's a nipple areola complex. Then when we go down, there is lactiferous ducts and the lactiferous sinuses which are open into the nipple. When we go more down, you can see there is a segmentation of the ducts. These are the terminal ducts, large ducts, and then divide into the small ducts, and then the small lobules. They group into the groups of small acini, and this is terminal ducts and the acini. They forms the terminal duct lobular unit. Okay, so we divide into the different parts: lactiferous ducts and sinuses, then segmental duct, and this is lastly terminal duct lobular unit. This whole structure is surrounded by interlobular stroma, and there is an interlobular stroma. Right? If we see the more closer view of the internal organs, here in the different parts, in this diagram we can easily understand the different parts, how they in this diagram we go from the internal surface to external surface. So start from this internal part. Innermost parts is this acini. Okay, these are the mammary, also known as the mammary glands. These are mammary glands. We known as mammary gland because they secrete the milk. Milk is produced in these glands, and these glands are lined by the two layer of the cells. Outer layer is a myoepithelium. There's a red one is a myoepithelium. What says myo means muscles and epithelium. The epithelial lining, they have the structure of the muscle like action. They help in the contraction of the acini, mammary glands, and help in the milk ejection of the milk from the lactiferous ducts and sinuses. So an inner lining is epithelial cell lining. Okay, there is a two lining. Outer is a myoepithelial cell and inner is a epithelial lining. These these mammary glands, now they connect to form. These are the different small segmental ducts, the large segmental ducts, and they forms the lactiferous ducts, and then lactiferous ducts open into the nipple. And this dark area around the nipple is known as, this dark yellowish area around the nipple is known as areola. Okay, whole the structures is surrounded by collagen and elastin. These are the collagen bundles, collagen fibers, elastin fibers. They surrounds the whole this acini, whole the mammary glands and the ducts, and this also surrounded by the adipose tissue. This whole the elastin fibers supported by this Cooper's ligament. Okay, so this is a normal anatomy of breast. Previous one was the line diagram. Here you can see the histological diagram of this whole normal breast tissue. How we see this parts into the this area. You can see there is a large duct. This one on the right side you can see this is a large open white area is a large duct, and large duct divide into the small branches. You can easily see the branching. And on the left side these are the lobules. This acini, they are the lobules. Okay, on the left there's a lobules. Clearly see, you can see easily. And this everything is surrounded by these lobules, and these ducts are surrounded by a collagenous stroma. Okay, and the leftmost part you can see there's a white area. These are the fat, adipose tissue. Clear? So in this histological slide you can easily see all this structure clearly. This is a duct, large duct, then small ducts, then these are the lobule. Clear? So this is a normal anatomy of the breast. Why normal anatomy is important? So on this basis we can divide the different pathology of the breast. Okay, previously we discussed terminal duct lobular unit. Here this is a diagram showing terminal duct lobular unit. These are the small ducts. They are surrounded by the mammary glands, the small lobules, and this is surrounded by this loose stroma, and then outer layer is a dense stroma. So this whole lobule is known as terminal duct lobular unit. This is very important to understand this terminal duct lobular unit. So we can divide the different pathology, the pathology related to the different lobule, or pathology related to the duct, or pathology in the glands. So we have to understand the different parts of this breast. Now comes to the pathology of breast. We divide the pathology of the breast into, first we discuss the disorder of development and growth, then inflammation, fibroblastic changes, proliferative breast disease, and lastly now comes to the disorder of development. In this first category is supramammary nipple or breast. This results from persistent of epidermal thickening along the milk line. This is extending from the axilla to the perineum. Anywhere the axillary breast tissue can occur. This is result from the remaining breast is remain in the axillary fold. In adult breast, we can detect the breast tissue in the axillary fold. Why this is important to understand? Because this pathology in the axilla can be related to the breast. Okay, sometimes in later stage there is a disorder related to the cystic changes can occur during the menstrual cycle, and the supramammary nipple and supramammary. Now next category is accessory axillary breast tissue. What is accessory axillary breast tissue? Means breast tissue is present into the axilla. Okay, sometimes this normal breast tissue can extend into the subcutaneous tissue of chest wall or into the axillary fossa. Why this is important to know this pathology? Because sometimes after the complete mastectomy in the cases of the breast carcinoma, there is a mass appear in the axilla, or the mass may look like a axillary mass, or it look like a enlarged lymph node. But when we do the histopathology, we can see there is a normal breast tissue is infected with the cancer or some other pathology. So fibroadenoma can be occur in the accessory breast, which is present in the axilla. So it might create the confusion. Next is a congenital inversion of nipple. Congenital inversion of nipple is the failure of the nipple to evert during development. As common condition, it may be unilateral or may be bilateral condition. Inversion is usually spontaneously correct during the growth activity in the pregnancy, but sometimes it's need to correct by the traction or by the giving the traction to the nipple. Why this is important? Again, in the adult condition, if there is this inversion of nipple associated with any inflammation, so we have to differentiate this inversion of nipple from invasive carcinoma of the breast or any inflammatory condition of the breast. Then comes to the next category, it's a macromastia. Macromastia is a congenital disorder, just a enlargement of the breast without any sign and symptoms to the patient. Next, opposite to this is a failure of growth of the breast tissue. This is commonly seen in the Turner syndrome. So all these are the congenital disorders of breast, which are very important to understand about each and everything to differentiate this normal congenital disorder from any other pathology. That's why they are important. Now comes to the different inflammatory condition of the breast tissue. To discuss this inflammatory condition of breast tissue, first we'll discuss the clinical presentation of breast disease. How the breast diseases clinically appear. What are the history of the patient you have to take. Most common symptoms which are reported by the women are pain or palpable mass, and third is a nipple discharge. So patient mainly presented with the pain. We have to take the history about the pain. Pain in the breast is known as mastalgia. Okay, it's the most common symptoms, and it's maybe associated with, you have to take the history about the pain is associated with the menstrual cycle or not. So cyclical pain, diffuse cyclical pain is there. So it might be the hormonal changes. There is no need of the treatment. So there is no need of the worry in these cases. Diffuse pain and the whole chest, but when it is localized to the some area or it's not associated with the menstrual cycle, so you have to look for the other pathology of the breast. Next clinical symptom is a discrete palpable mass, the second most common breast symptoms. You have to be distinguished from the normal nodularity of the breast. Whenever patient comes to you with the complaint of breast mass, she is feeling some mass in the breast, you have to be very careful about that. The subnormal nodularity of the breast may be appear as a palpable lump. A breast mass usually significant when it's around 2 centimeter in diameter, that only we can palpate the breast lump. Less than 2 centimeter is very difficult to palpate. Commonly encounter lesions during when we detect the breast mass, what we suspect. You have to suspect first the most common lesion in the breast is a fibroadenoma or some cystic changes commonly associated with the pain. Next clinical symptom is nipple discharge. Nipple discharge is less common presenting symptoms, and we'll discuss with all the pathology in which condition you get which type of the discharge. Like in this slide you can see there is a ductal ectasia. Ductal ectasia is commonly associated with the nipple discharge. Carcinoma associated with the nipple discharge. Bloody discharge we can get in the breast papillomas, ductal papillomas associated with the bloody discharge. Okay, then what else you have to be assessed in this patient? First, the clinical history is very important. With each pathology we'll discuss the clinical history of the patient. Second, we'll discuss with each category, we'll discuss the mammographic screening. Mammographic findings, it's very important in this patient. Very small masses which are not detectable, non-palpable breast cancer can be detected by the mammographic finding, because most of these masses can be associated with the calcification. So we can detect the calcification in this by the mammography easily. That how the calcification appears in the benign lesion and then the malignant lesion. It's very important. So screening is generally you have to advise your patient for the screening of the breast after the age of the 40 years. Advise for the mammography to detect any calcification is there or any small masses is there. So you can detect the in situ carcinoma or any other pathology by the mammography very easily. In this